Hello, everyone. Good morning, good afternoon, and good evening. My name is Cecilia Sorensen, and I'm delighted to welcome you to the launch of the Southeast Asia Climate and Health Responder course. This course is made possible by a tremendous collaboration between the Global Consortium on Climate and Health Education, St. Luke's Medical Center, and Healthcare Without Harm. We have come together around the pressing regional need to rapidly build resilient health systems in the face of mounting climate and environmental change. We have an exciting and ambitious month planned. The objectives of this course are to increase health professionals' knowledge, self-efficacy, and communication skills related to the climate crisis, so you may both improve patient care and public health practice, as well as serve as a trusted climate and health messenger in your community. Simultaneously, our goal is to build and strengthen an agile and informed community of practice in climate and health within the Southeast Asia region. This course will meet every Tuesday and Thursday for the next 4 weeks at this same time. Over this month, we will cover an introduction to climate and health, extreme weather events and disasters, climate change and infectious diseases, climate change and non-communicable diseases, climate change and mental health, as well as climate smart healthcare, leadership, and advocacy. Each session will be 90 minutes in length and will consist of a lecture followed by a case study and time for question, answer, and discussion. Every session will be recorded and will be posted on the website within 24 hours. Reference materials, as well as additional readings, will also be provided, and you can find those in the weekly emails as well as on the website. Right now, you will see in the chat that we have a link to the website where you will be able to find all this information. We invite you and encourage you to use the chat function to introduce yourselves, to make comments to each other, and to ask any questions you have to our presenters. There is a certificate available for those of you who attend 6 out of 8 of our live Zoom sessions and take both the pre and post-course survey. The certificate of participation will be awarded on behalf of Columbia University, St. Luke's Medical Center, and Healthcare Without Harm. Again, we are delighted to have you here today. And we ask you now that if you haven't already, to please use the link in the chat to take the pre-course survey. We're going to give you about 3 to 5 minutes right now, and we are really grateful for you for filling out this survey. Thank you. Thank you, everyone, for completing the survey. We'll give you about 1 more minute. Thank you, everyone, so much for filling out this survey. It helps us to improve our courses and to make sure we're really meeting our goals. So without further ado, it is my pleasure to introduce our speaker for today, Dr. Renzo Ginto. He is an associate professor of the practice of global public health and the inaugural director of the Planetary and Global Health Program of St. Luke's Medical Center, College of Medicine in the Philippines. So over to you, Renzo.
Thank you very much, Cecilia, and thank you so much to the Global Consortium on Climate and Health Education for this wonderful collaboration on behalf of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines, and of course, our other partner, Healthcare Without Harm Southeast Asia. We're really, really grateful to the consortium and to Columbia University and to you and to RISA for, again, this amazing opportunity for us to work together to produce the next generation of climate and health professionals and healers. So this session is really to give everybody a brief overview about climate change and its links to human health, And as you can see in this screen, I hope we will be able to answer the question why we health professionals in Southeast Asia should bother. Okay? And so, by the way, I can see that someone is scribbling on my screen. So if we can avoid that, that will be great. In the next several slides, I'll be talking about why climate change is a health issue, why we health professionals should play a role, what we can do. And then hopefully this also provides you with an overview of what's going to happen in the remaining 7 sessions this month of June. And by the way, this is a very timely course because yesterday we celebrated World Environment Day, June 5. And so I hope that we will all embrace the environment, and that every day should actually be a health and environment day. And hopefully this course will provide you with the inspiration to embrace that kind of mindset. So let me begin with this cartoon, which probably you have seen on social media. As you can see, there are many different waves of challenges, of threats that we are currently facing in the 21st century. You know, the smallest wave is COVID-19, although for the past 3 years, it didn't feel like a small wave indeed. And perhaps many of us here are still very concerned about future waves of this coronavirus. But in this day and age, I think we should be equally, if not more, afraid and concerned, not just about future waves, but future tsunamis. As you can see in this cartoon, tsunamis of climate change and biodiversity collapse, and the many different ecological threats that are jeopardizing the health of human populations, our health, because our health, as we know, is deeply intertwined with the health of the planet. And I know in the health sector, we health professionals, we have many different ways of measuring the health of populations, the health of people, the health of our communities, life expectancy, maternal mortality ratio, infant mortality rate, so on and so forth. But there is also a way to measure the health of our planet. And I want to introduce to you this framework called the Planetary Boundaries Framework. The Planetary Boundaries Framework says that our planet has boundaries, has limits. And these limits, these boundaries cannot be violated. We cannot overshoot beyond these boundaries. Because if we do so, it makes the planet, our planet Earth, less conducive for human survival. So here you will see in this diagram, in this circular diagram, that so far scientists from the Stockholm Resilience Center in Sweden have identified 9 planetary boundaries. The sad thing, or the bad news, is that out of the 9 planetary boundaries, 6 out of 9 have already been violated. The boundary for climate change, which we will be discussing extensively today and in the rest of the course, but also the boundary of biosphere integrity or biodiversity. We know that it's important that our ecosystems have rich biodiversity. They provide us with food and natural medicines. They stabilize our ecosystems. Unfortunately, over the past century, we've seen the fastest rate of extinction of creatures, great and small. Land system change. We've been turning every rainforest or natural habitat into subdivision, into cities, into golf courses, shopping malls, so on and so forth. So that's land system change. In a nutshell, or in summary, we have been humanizing the natural environment through the way we use our land. The biogeochemical flows of P and N, those are 2 important elements in the periodic table, phosphorus and nitrogen. Because we have been pumping artificial fertilizers with phosphorus and nitrogen into the soil in the name of large-scale agriculture. So those are the 4 planetary boundaries that have already been violated. The 5th one is the boundary for novel entities. When we say something is novel, it's new. And this term pertains to the chemicals, to the compounds that we invent in the laboratory, we manufacture in the factory, and we release to the environment. And one of the biggest or the most serious examples of a novel entity that we've released to the environment is plastic. Because now you go to the ocean and there, our seas, our waters are already filled with lots of plastic. And just last year, microplastic has also been already detected in the human bloodstream. So they are in the water, but they also in the in the bloodstream as well. And then the most recent planetary boundary that has been violated is freshwater change or freshwater use, because our rivers and our lakes have already been not only overconsumed, but also over-contaminated with all the chemicals and novel entities that we've been producing and consuming. So 6 out of 9 planetary boundaries, this should be a cause for alarm for all of us health professionals, especially here in Southeast Asia, because all of these problems are happening in our region. For example, the Philippines was recently declared the country that is the top polluter of ocean plastic. And we know also that many of our rainforests in Southeast Asia, in Indonesia, in the Philippines, in Malaysia are being destroyed, which are going to also violate the planetary boundary. So now, this is what's happening. We have been violating the planetary boundaries. We have been creating new ecological problems, global pollution to the air, water, and land, biodiversity loss, as I already described to you a while ago, climate change. All of these are generated by our irresponsible human activities, our consumption patterns, the demographic shifts that we are seeing, like migration and urbanization, continuous population growth, and rapid technological advancement. All of these creating these problems, these violations of the planetary boundaries, which then eventually, in turn, lead to a wide array of health impacts, which you can see on your right. So usually, we are focusing on the diseases as health professionals. We are focusing on improving the health and protecting the health of people. We forget about what we call the upstream drivers or the determinants of health that are emanating or originating from the environment. I forgot to mention, there's a term here, Anthropocene. Anthropocene is a term, you might be familiar with the term or the prefix anthropo. Anthropo means man. Because now it's humanity that is really changing our ecosystems, shaping the face of the earth. It's not anymore a natural phenomenon. It's human-induced change. That is what we call Anthropocene. We live in the era of the Anthropocene, and our health is shaped by these changes. So, of course, there's, as I mentioned already, the different planetary boundaries. And one of the planetary boundaries that is already in grave danger is the boundary for climate change. And that's why a lot of young people now around the world are calling for, as you can see in this photo, climate justice now. And I think that we health professionals should be part of this movement. We should also be calling for climate justice now, because there can be no health justice without climate justice. And that's why it's very important for all of us to learn more about climate change, how it's affecting human health, and what we should do. And that is really what this entire course is about. So now, you might be wondering, what is climate change? I'm sure you've been hearing it in the news, you've read about it, but let me give you a quick overview or review of climate change, which I'm sure you've learned when you were in college or even in high school. So I'm sure you're familiar with the greenhouse effect. So there's an ozone that covers the planet Earth, and many other gases in the atmosphere. The sun enters the planet Earth, and then the heat of the sun bounces back or bounces outwardly towards the atmosphere, towards the outer space, from the planet Earth. But then some of the heat is being contained inside. Remember, when we say a greenhouse, that's how it functions. It keeps the heat inside the greenhouse so that the plants that we're growing in the greenhouse are able to grow in the right conditions. But what is happening now is not anymore natural greenhouse effect. It's human enhanced or human worsened greenhouse effect. Because we've been emitting a lot of what we call greenhouse gases into the atmosphere, which then creates a very, very thick and strong, I would say, cover that disallows the bouncing back of the heat towards the outer space or outside of the planet. So a lot of the heat gets contained inside the planet, and such increase in heat inside the planet then leads to the many changes that we're seeing in the environment, the ecological changes. And later on, I have a slide for that. So I already mentioned it's because of our emissions of greenhouse gases. Where are these greenhouse gases coming from? So here you will see, number one, you will see that there are different types of greenhouse gases. You might be hearing all the time, oh, it's carbon dioxide. And it is indeed an imported greenhouse gas. It's around 72% of the total greenhouse gases that we emit to the atmosphere. But we need to remember that there are also others like methane and nitrous oxide that are also contributing to the climate crisis. But where are these greenhouse gases coming from? So you will see at the top pie chart that there are many different industries and sectors that are emitting greenhouse gases, carbon dioxide, methane, nitrous oxide. The largest really is our energy systems, our electric power stations. We need energy to ensure that our economies are operating, that our households have light and heat or air conditioning. But that means we are burning a lot of fossil fuels like coal and petroleum and natural gas in order to, meet our needs, our energy needs. But at the same time, we are also in the process emitting a lot of greenhouse gases. So the energy sector, electricity sector is the biggest contributor of greenhouse gas emissions. But you will see that there are other sectors as well that are contributing. For example, the industry, our factories, our transportation systems, especially our cars, which are burning a lot of petroleum, of diesel, burning of forests, land use change, because when we turn them into farmlands, the tendency is people and companies, they burn the forest and turn them into agricultural land. And there are also some greenhouse gases being emitted from our waste disposal systems, our residential and commercial facilities, like our houses, and many others. So there are many different sectors contributing to this crisis. Okay? So what is happening? When we have climate change, what is happening to our environment? So this diagram summarizes the different effects on ecosystems of climate change. You will see here, for example, changing rain and snow patterns. So of course, in Southeast Asia, we don't have snow, but in Asia, we have rain and storms and typhoons, and these are now growing in number and in severity and in frequency. Higher temperatures, more heat waves. I'm sure over the past several weeks, we have been complaining a lot about hotter weather, for example, here in the Philippines, but I'm sure also in the neighboring countries in Southeast Asia. Wildfires, for example, as what they're experiencing in Australia or in California. And of course, our seas are also affected, not only the land. There's damaging of the corals, and we know that corals are the forests of the sea. That's where our fish and other marine creatures do live, reside, and grow their population. And therefore, there will be huge impacts on the fisheries if our corals will continue to be damaged. The rising sea level because of the melting of the ice caps, but also because of the warming of the oceans. And we know that the warming of the ocean expands water, and that leads to the rising of the sea level in coastal areas. For example, in the Philippines, we have 7,000 islands. And so this is an issue that we are already facing now. So these are just some of the effects on the environment. And it's not just our ecosystems that are being impacted. Our society, our economy, and eventually our health, as I've already alluded to a while ago, will be impacted by climate change. So let me enumerate some of the social and economic impacts. Relocation of whole towns. For example, when the sea level continues to rise and coastal cities and towns become inundated or flooded. Shrinking productivity of harvests because of drought, or maybe the typhoon is going to wipe out our croplands. And then we also have, for example, more resource battles, because remember, climate change is going to limit the amount of resources that we have, okay? And then loss of capacity to work due to heat. Our worker productivity will also be affected, because imagine farmers will need to be experiencing, intense heat, and that will affect their ability to, for example, work, especially physical labor. In the farmland. So these are just some of the impacts. And then, of course, the water supply as well will also be affected. They are now saying that future wars will not be over land, but due to water, because of water scarcity. And then it's mentioned there that diseases will also spread due to higher temperatures. So now I'm moving to the next slide. And I want to show to you, this diagram that summarizes the effects of climate change on human health. So before we go to the nitty-gritty, I want you to just make a general observation of the diagram. And what you will see is that, number one, there are many boxes. There are many boxes in the pillars of direct effects, indirect effects, social dynamics, because that means there's so many factors that are at play that links climate change to human health. So it's not an easy A leads to letter B, X causes Y. Climate change and health, their connection is much more complex than we understand it. And so that's why it's important to, have these kinds of diagrams to show to you that, storms, for example, affect water quality, which then lead to different kinds of health conditions. You will also see many different arrows. Again, it speaks to the complexity of the relationships between climate change and health. There are many different pathways that link climate change to human health outcomes. And then on your right, you will see that there is no single disease group that is going to be immune to the impacts of climate change. Take, for example, infectious diseases. Name it, malaria, dengue, or even COVID, or future pandemics. Cardiovascular and respiratory diseases, which are non-communicable, but certainly affected as well by the changing climate. Undernutrition. We are expecting the worsening of undernutrition in the coming years, again, because of food scarcity, because of the destruction of our farmlands by either droughts or intense storms and flooding. And even our mental health is also becoming affected by climate change as well. So these are actually topics that you will be encountering in the next several sessions, how climate change is affecting the different disease groups or disease conditions that we health professionals are very much aware of. And actually, I would like to invite you to visit this website of the New England Journal of Medicine. It's a very interactive website. You can click on the organ system, and it will tell you how that organ system is being affected by climate change. For example, if you're a dermatologist, I wonder if there's a dermatologist in this virtual classroom, even you must study now how climate change is going to affect skin health, skin diseases. And if you are, for example, a neurologist, there are also certainly impacts on, cognitive development and neurological illness, again, due to climate change. So the message is that every health professional and every specialist, and most especially the general practitioners, must actually be climate equipped, climate conscious, climate aware, because every disease group and every organ system of the body will be impacted by this emerging crisis. Another thing that we need to remember is that climate change, we know it's a universal issue. We know it's a global issue, a planetary issue. But the effects of climate change, especially on human health, will be and are already unfairly distributed across the global population. Some people will be affected more than the others. Some people will be affected faster than the others. So as you can see in this map, or these twin maps, at the top you will see the parts of the world that have emitted the greatest amount of greenhouse gases into the atmosphere. Remember, I mentioned to you what are the greenhouse gases. And there are countries that are leading the emitting of greenhouse gases. North America, Europe, and more recently, China, because we've seen China really grow as a global superpower in the past several years. Meanwhile, at the bottom, you will see the parts of the world that are suffering the consequences, that are bearing the brunt of climate change and its myriad health effects. Africa, huge parts of Asia. Unfortunately, many of the islands in the Pacific are too small to be magnified in this map. Perhaps they're even erased from the face of the earth because of sea level rise. Remember sea level rise, the one that I described to you a while ago. So here, the victims and the perpetrators of climate change are different. And therefore, if we want to address the impacts of climate change on human health, it has to have a strong equity and justice lens. We need to be giving utmost attention to the poor, the vulnerable, and the marginalized. So now in the next several slides, I'll just give you some sneak preview of the effects of climate change on human health. And again, as I mentioned, we have 4 sessions. After this one, we have 4 sessions that will really do a deep dive into the different impacts of climate change on human health. So this is just a sneak preview, and please make sure that you attend the several succeeding sessions. So here is Southeast Asia, our region of many islands, several countries, 10 countries under ASEAN, and of course we have other neighbors that are not part of the Association of Southeast Asian Nations, like Timor-Leste or Taiwan, but they're all geographically part of Southeast Asia. And we know that Southeast Asia is a climate hotspot. It's a tropical region. It's really at the heart of the climate crisis, of the environmental crisis. But as you can see in this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, I can see that we have a lot of Filipinos in the room. The Philippines is the reddest in this map, and therefore it's really the most vulnerable in the region. Although again, all the parts of the region are going to be affected by climate change, no doubt. And we know that one of the main impacts of climate change is extreme weather events, typhoons, intense flooding. This is a photo from 2013 when Typhoon Haiyan, the strongest typhoon to ever hit land in human history, affected central Philippines, killing more than 7,000 people, displacing hundreds of thousands, and affecting millions more. And when these calamities do strike, as you can see, it's not just our water and food systems, our hospitals, our houses, our farmlands, our school buildings, our establishments, all of these are being disrupted, if not destroyed. And in the Philippines in particular, over the past 2 years, we've seen the convergence between two crises. On one hand, we have the COVID crisis, and on the other hand, we have the climate crisis. And imagine you're a poor Filipino living along the coastline or along the corridor of the typhoon, and you are confronted with this dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus, only for the house or the roof of the house to be blown away by the strong wind? Or on the other hand, do I move to these cramped evacuation centers? As you can see in this photo, it's safe from disaster, but as you can see also, there's no social distancing or physical distancing to begin with in these temporary shelters. So there's a very high chance that you will be contracting the unseen coronavirus. So this is a reality that many Filipinos have endured for the past 3 years. And next week, don't forget that our next session will be on extreme weather events and disasters and how these events affect human health and what should we do as a health sector to protect our people from these catastrophes. Another set of impacts of climate change is when it comes to infectious diseases. As you can see in this article, the planet's health is essential to prevent infectious disease. And so we cannot anymore just focus on biomedical, clinical approaches. It's not only the antibiotic that will address infectious disease. We need a broader, more holistic, integrated approach that it also includes addressing the environment, addressing climate change. In fact, for example, dengue, which is a mosquito-borne disease that is endemic in Southeast Asia, is already now being found in some parts of the world where they've never existed. For example, Europe. Dengue cases are surging around the world. They're also going to new places. And one of the main drivers is climate change, because we know that mosquitoes are looking for the right environment for them to thrive. And it's not just the mosquito-borne diseases that are being affected. Also, zoonotic diseases. When we say zoonosis, they are diseases that are due to pathogens, viruses, microbes that jump from animals to other animals or even to human beings, like COVID-19. And there's a very recent study that showed that climate change by itself could spark the next pandemic. We know that there are many different drivers of zoonosis, but climate change in itself is going to drive it. And as you can see in this map, the pinkest region, which is Southeast Asia, is where these events, these zoonotic spillover events, can happen again within our lifetime. So after Thursday, the next session next week, Tuesday, will be about infectious disease and climate change. And so I want to make sure that you are there, because you will learn more about how climate change affects infectious diseases. And then we have also other impacts of climate change, which I already alluded to a while ago. It's not only the storms and the flooding, but there are also some slow onset events. Okay? That's another term that you may want to remember. So one is the extreme weather events, typhoons, flooding. And then there are the slow onset events. They're happening slowly, more subtly, but they have long-term impacts on communities and on human health. One of which is sea level rise. And I already described to you how sea level rise happens a while ago. There's the melting of the ice caps, the warming of the oceans, and then the level of the sea continues to rise. And of course, the land that is facing the sea then becomes inundated and flooded. And so what are the effects of sea level rise on health? For example, there's growing evidence that because of sea level rise, seawater, which is high in salt, begins to intrude freshwater systems. And then people start drinking water from their wells, which is high in salt content, salinized water, which then leads to a wide array of negative health outcomes. These are just a sample of studies, several studies that have been conducted on the impacts of consumption of water that is high in salt, the impacts of that on human health, impacts on maternal health, increasing blood pressure, preeclampsia and gestational hypertension, miscarriage, impacts on infant and neonatal mortality, even kidney stones. So this is a new area. And I guess my message to you is that climate change is going to affect diseases that are already familiar to us, such as the ones that I mentioned to you a while ago. But there are also new health conditions that we've never seen before that we are anticipating as a result of the changing climate. So this is also a new arena for research. So for those health professionals who are in the Zoom, who are also into research, I hope that this course will inspire you to do more cutting-edge, innovative research on the nexus of climate change and human health. And this is one of the long-term effects of sea level rise in human populations. The capital city of my country, the Philippines, Manila, is expected to be underwater by 2050 if climate change isn't going to be averted. And this will lead to massive forced displacements of human populations. And this is going to happen not only in Manila, but also in Bangkok, in Jakarta, in many of the big mega cities of our region, and even the second tier or the smaller cities that are facing the sea and the ocean, they're also going to be affected as well. And then now the other slow onset effect is increasing heat. And I already mentioned it to you a while ago. And unfortunately, our region, Southeast Asia, will be continuously experiencing increasing temperatures in the coming decades. Okay? Our heat indices, for example, in the Philippines are, now at astronomically high levels, which are then difficult to withstand. And heat-related illness is going to increase in our region, and we need to build our capacity to address this emerging public health threat. In fact, as you can see at the top, title, there are cities in the world that are already appointing what they call chief heat officers. So I'm sure you're aware of the chief executive officer or the chief medical officer in your hospital. Now they have chief heat officers who are in charge of developing plans for their community in order to address the growing impacts of increasing heat on human health. So this is another new arena for many of us. And then a while ago, I already mentioned that it's not only our physical health that is being affected by the changing climate. It also affects the health of our brains and hearts as well. And so the emerging nexus of climate change and mental health is something that that requires a lot of our attention, and if there are psychiatrists in the room, but also general practitioners who provide, psychosocial support, counseling, especially to many young people experiencing mental health challenges today, this is something that you may want to look into as well. And there, as you can see in this series of, in this bar graph, there was a study that was published in 2021, and it was found out that out of the 10 countries that were surveyed, it's the young people of the Philippines are the ones that are feeling the most anxious, climate anxious in the world. Climate anxiety is now a growing phenomenon that is being studied by many researchers. And several sessions from now, you will actually have a session on climate change and mental health. And we invited one of the leading environmental psychologists of Southeast Asia to talk about this emerging challenge. So I just gave you a sneak preview of the many different impacts of climate change on human health. And what we are realizing is that our people are sick and our planet is also sick. And we cannot anymore continue treating sick people living on a sick planet. And that's why at the St. Luke's Medical Center College of Medicine, I always remind my medical students that in this day and age, in the 21st century, we now have two patients. On one hand, you have that kid wearing a face mask, trying to protect herself from the unseen coronavirus. And on the other hand, you also have Mother Earth also wearing a face mask. Of course, not to be protected from SARS-CoV-2, but instead to be safeguarded from the myriad ecological damages that we are inflicting on her as a result of our irresponsible human activities and decisions. So we now have two patients, not just the people, but also the planet. And that is what the concept of planetary health is about. And so I'm introducing a new concept, a new term. You may be familiar with public health, and especially in these past 3 years during COVID-19, we often hear in the news, we need, good public health leadership, public health response to protect people from SARS-CoV-2. But that is just talking about the health of people. We're forgetting about the health of the planet, on which our health greatly depends. And so I invite you to broaden your view of health, to now start looking at not just the people's health, but also of the planet's health, to embrace the planetary health paradigm. And this is something that is, not totally new. It's not a novel invention. You might think, oh, planetary health is a new term. But even in the indigenous communities, the indigenous populations of the world, for centuries, they have already acknowledged the inextricable linkage between the health of people and the health of the planet. According to Chief Seattle, an indigenous leader from the Americas, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. Isn't that the crisis that we're describing to you a while ago? The harm that we do to the planet, they all come back to us in the form of human disease, despair, and death. So that is really the planetary health message. And even the father of Western medicine, Hippocrates, also have been instructing us many, many centuries ago. And I will not be reading this quote verbatim, but he was saying here, we need to study the seasons of the year, the hot winds and the cold, the properties of water, and how all these environmental factors are affecting the health of people, the health of our patients. And then also there's this Australian epidemiologist, Anthony McMichael, who is one of the first to actually write about the connection between climate change and health. He wrote in the 1990s, the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda, which I now believe is what we call planetary health. He's saying that we need to start looking beyond the health of people. We need to start looking also at these bigger ecological horizons. And as you go down, you will also see he's urging us to develop an ability to collaborate with unfamiliar disciplines, such as climatology, ecology, environmental sciences, even animal health, among others. So I always remind my students in St. Luke's that by the time they graduate from med school, they should have at least 5 friends who are not fellow physicians. You cannot just have doctors as friends. You have to have friends who are, one, from the other health professions, and number 2, from the other disciplines and professions outside of health, like the environmental science, engineers, economists, ecologists, so on and so forth. And so later on, I would love to hear if you are also having your own network of fellow colleagues who are not from the health professions. But this is what's happening, especially in the past 3 years. The medical community continues to operate as if the global climate system is doing okay, as if there's no climate crisis. And in fact, over the past 3 years, we did not only not incorporate climate sustainability in our practice, we even created new forms of pollution, such as the PPE pollution, personal protective equipment pollution that we're seeing around the world, in our seas, in our lakes, in our oceans. Okay? So we need to start rethinking the way we practice medicine and health in this day and age. We need to answer this question: are we ready to build health systems that consider the climate? Are we ready to become health professionals, doctors, nurses, pharmacists, dentists, therapists, psychologists, and many others? Are we ready to become planetary healers, to be doctors, to be healers, not only for the health of people, but also for the health of the planet? Are we ready to be a health sector that embraces planetary health principles and that is in the front lines of addressing the nexus of climate change and health? So in the next several slides, I'll just give to you a sneak preview of the final sessions of the course. If you remember, we have sessions 6 and 7 that will focus on this concept of climate smart healthcare. Climate smart, when we hear climate smart, so you might have heard phrases like climate smart agriculture, climate smart cities. In fact, the health sector is late in the game. We're just using climate smart only recently. Climate smart means being at the convergence between sustainability and resilience. Sustainability, environmental sustainability, being green, lowering the environmental impact, the ecological footprint of healthcare. Because we don't want to do harm to the planet in the same way that we made a promise in the Hippocratic Oath to do no harm to our patients. We also need not only to be sustainable, we also need to be resilient. And resilience means we are able to adapt to the changes that are brought about by the climate crisis. We are able to continue providing care, even if there's a storm or typhoon or flooding or drought or a heat wave, that we are the last sector standing in the face of climate disaster, that we are bending without breaking, like the resilient bamboo, which is something that is common in our region. So we need to embrace climate smart healthcare. And one part of climate smart, as I've mentioned, is sustainability, mitigation. That's another term that you will be hearing in the coming days. We want to reduce our carbon emissions. Remember the greenhouse gas emissions that I described to you a while ago, because the health sector is also emitting its own greenhouse gases. So in session 5, you will be learning about how we can reduce the environmental footprint of healthcare through climate mitigation. And these are just examples. One of my hobbies is to go around the Philippines and to take photos of hospitals that are already embracing solar power. So those are just some examples of hospitals that have already transitioned to green energy. And then you also have, I mentioned to you a while ago that one of our partners is Healthcare Without Harm. And they have this global green and healthy hospitals agenda that can help you reduce the environmental footprint of healthcare. And then I told you a while ago that the other part of the equation is resilience. We need to build climate resilient health systems that allow health systems to recover and even to transform when a climate impact, a shock like a typhoon or a stress, a shock is something catastrophic, stress is something slow onset, like, for example, increasing heat. When a shock or a stress happens, we want the health system to recover better than before, and even transform. We don't want our healthcare systems to collapse. And so that is what resilience is about. And in session 7, we will be talking about how we can build resilient health systems. There are many tools, frameworks, such as that circular framework from the World Health Organization on building climate resilient health systems that you will be learning. And here are some pictures of what we're doing in the Philippines to work with local health systems, enhance the resilience to the changing climate. Okay. And then I want all of us to remember that addressing climate change cannot only stay within our own sector, within the health sector, among the health professionals, within our clinics and hospitals. Because remember, every sector is emitting their own carbon. Every sector is affected by climate change. And therefore, we need to work across sectors. There has to be action in all sectors. There's a need to engage in cross-sectoral collaboration. And so that's why there's urban planning, there's the energy sector, and then also the transport sector, the food sector, etc. So we need to make sure that we in the health sector are leading, but also working with the other sectors to ensure that we have a healthy people and a healthy planet. I just want to end, and I hope that you're not distracted by the lines that were scribbled probably by one excited participant. Planetary health is about planetary humility. It invites us to shift away from this ego-logical perspective. Oh, we are at the top of the pyramid of nature. We can consume, kill, pollute, extract, mine, contaminate. And instead, we need to shift towards a truly ecological perspective where we human beings are in greater solidarity, are in deeper interdependence with all creatures great and small, and all the other components of planet Earth are one and only home. So together, let's all be planetary healers. And thank you for joining this course. I hope that this introductory lecture inspires you more to finish this 8-day, 8-session journey, because we all need to be working together towards advancing the health of both people and the planet. Thank you again, and I look forward to your questions and comments.
Hi, Renzo. There was a question in the chat in reference to your slide on greenhouse gas emissions. And they were asking whether those references were relating to Southeast Asia or whether they were global values that were being reported.
Great question. Those are global values. And we know that Southeast Asia, as a booming region in the world, certainly contributes a lot. One, in terms of energy production, unfortunately, our region, many countries in the region are still utilizing a lot of coal-fired power plants, Philippines, Indonesia, and the others. And so that surely is an important contributor to emissions, but also agricultural sector and land use change. We have been killing our forests and turning them into farmlands, and that also in the process emits carbon. So there are many different sources of carbon in the region. We are contributing to the crisis. And so yes, we need to demand change from, let's say, the big countries or the rich countries in Europe and North America, but there are changes that need to happen within our own backyard. And that's why mitigation is very important, and I hope the health sector will lead advocating for it.
Thank you, Renzo. There was another question in the chat, which I believe we will be answering later on in the course as well, but I wanted to go ahead and ask it anyways. Walter Jamie is asking if there are any relevant solutions or prevention in terms of climate change, particularly to those developing countries which are not contributing much to climate change.
Yeah. Thank you very much. Well, and when you say prevention of emissions, right? And when you want to prevent emissions, we need to transition to renewable energy. And, our region is rich with natural resources. There's actually an acronym that we always use here in the Philippines, the Big Show. And we always say that in the Philippines, we have the Big Show for renewable energy, B for biomass, G for geothermal, S for solar power, H for hydroelectric, O for ocean, thermal, and W for wind. So we all have those renewable energy sources, and unfortunately, we're not yet really capitalizing on them at a grand scale. So that's one example of how we can prevent climate change from happening in the first place. If the question is about preventing the impacts of climate change, that is where adaptation or building resilient health systems is crucial. And therefore, we need to first understand how our diseases will be impacted by climate change. That's what we are going to talk about in the next 4 sessions. And then we have a session dedicated to building resilient health systems. So that is part of our adaptation role as a health sector.
Thank you.
There's so many comments.
Lots of comments.
Thank
I'm
you
glad
very much.
everyone's so engaged. There's another question asking if we are aiming to meet the Kyoto Protocol and Paris Agreement as climate and health responders.
Yeah. So Kyoto is gone because it was replaced by Paris. But also after Paris, there are many different agreements that have arisen. There's one on the Glasgow Pact. There were one recently from Egypt. And then, of course, this upcoming COP28, then the climate negotiations that are happening in the United Arab Emirates. And that is actually something we need to be paying a lot of attention to because, UAE, we know, is a major oil producer. There'll be a lot of oil lobbyists, petroleum company lobbyists in that negotiations. And we want to make sure that we have a very strong voice in that negotiations. The health of the planet and the people should be, heard much greater, much louder than the voice of the fossil fuel industry. In terms of, are we going to meet the agreements, specifically Paris? Because, and that's what I forgot to include in the slides, right? The Paris Agreement, which is an important agreement that all countries have signed up for. It says that we cannot allow the global average temperature of the planet to increase by 1.5 degrees Celsius by 2030. The sad news is that scientists have just published a few weeks ago that we are probably going to violate the 1.5 degrees Celsius, not in 2030, but in 2027. So we are 3 years going to be faster than what was earlier anticipated. So our reduction of greenhouse gases needs to happen very fast. Otherwise, we will reach that point of no return, which is irreversible, and we can anticipate more catastrophic impacts.
Thank you. There are a few questions asking about any specific courses and schools that offer green healthcare systems courses. We can certainly add those resources to the weekly emails, but if you wanted to touch on that briefly, I'll give you a moment.
Sure. Well, this is the first, right? This is the first Southeast Asia-wide. It's going to give you really a climate and health 101. And this is really for all health professionals across Southeast Asia. All the but if you, for example, are a hospital administrator wanting to start some green and climate resilient initiatives in your institution, one, there are many resources online. We will share them with you throughout the course of this course. Number two, we in St. Luke's actually offered last year a certificate course on climate smart healthcare. And if there's a high demand, we can organize it once more. It will be concentrating on hospital leaders, because hospitals, as we know, and as we will learn on session 5, are also contributing to carbon emissions. And then there are many other resources. Of course, please visit the website of the Global Consortium on Climate and Health Education, because it is the basically the world's repository of curricula, of course materials, of modules that you can actually study on your own and that you can also share to your students. For example, if there are educators here, deans of nursing schools, medical schools, there's so much resources online that we can use. But hopefully this course will inspire you to go to the next step. Thanks.
All right, there are a few questions and comments regarding how to engage with public officials who may or may not be knowledgeable about or perhaps not care about climate change and its effects on human health and human communities. Could you please comment on that?
Thank you. Very important question. And, I think we need to actually tell more about the human face of climate change. When we talk to the politicians, the elected officials, also non-elected officials working in government bureaucracy, we need to really be telling them about the impacts of climate change on human health, right? Not just on the agriculture sector, not just on, our environments and, other aspects of society, the economy, but most importantly about human health, how it will impact human lives. And hopefully that will really bring the conversation to the next level, because it's really our survival that is, on the table here. But also, and I guess this is why we're organizing this course. One, we want to make sure all health professionals in the region are knowledgeable about climate and health. You cannot have a conversation with your politician, your local leaders, if you don't know what the issue is about. You also need to know what the solutions are, because of course they will be asking, what are we going to do for our hospitals, for our food system, for our energy sector? And so now you have an idea of what needs to be done. And of course, you need to do more research and self-directed study. And then also, hopefully, throughout this course, you will be meeting a lot of amazing climate and health advocates. And it will give you an idea of how to communicate climate change and health. Later on, we have a quick exercise on telling your story. And so I hope that it's not just about the content, the technical knowledge, but it's also about the how, right? The how. How do we tell this story? How do we influence our leaders? And in the succeeding sessions, you will be meeting a lot of amazing people who have done it in their own communities. They managed to influence their hospital president to, make some bold decisions in embracing climate smart healthcare. They're able to influence their Department of Health in their country to prioritize climate and health. So yeah, and that's why you should attend the remaining sessions of the course.
If we have some more time, Renzo, there are quite a few questions about healthcare sustainability and mitigation. I know we'll be covering that in a later session, but would you like to briefly comment on it at this time?
Right. Well, so again, we have a session for that. So maybe I'll keep it as a suspense so that you will attend and learn directly from the experts in the greening of healthcare. You will be encountering case studies, actual examples, and again, leaders. We are going to listen to them in some of the sessions. But I really appreciate, one, the energy in the chat box, right? The interest. Now, health professionals from across the region really interested to learn about what we can do. And number two, I can also see some sharing of information. So, let's create this culture of information and knowledge sharing. So, because I'm sure everybody has something to share and to say. So thank you for maximizing the use of the chat box.
All right. At this time, I'm seeing a lot of questions about healthcare and medical waste, about how to advocate for the climate and health crisis in our clinics. Hopefully, over the course of all the sessions, we'll be able to cover all of this and answer more questions as we enter the new sessions with our expert lecturers. So please stay tuned. We are going to go ahead at this time and move on to the next section of this session.
So as we have just heard, climate change is having broad and significant impacts on human health. Yet for many of us, we already know this intuitively through our direct experiences caring for patients and communities who are being affected. And our stories are essential as we work to mount a regional and global response to the climate crisis. So stepping back a minute, let's consider why health professionals are considered such essential messengers for climate and health. First of all, because of our experience and expertise in human health and our training that got us to where we are, we have a deep understanding of the human body, of disease processes, and of the factors which impact health. So therefore, we have the necessary knowledge to explain and understand how climate change is affecting human health, including the direct and indirect health impacts. Second, as health professionals, we have public trust and credibility. We know that again and again, health professionals are ranked highest among all professionals in society in terms of our honesty and ethical standards. We are seen as objective, reliable sources of information and are often the first point of contact for individuals who are seeking advice and treatment. Third, we have tremendous experience in communicating complex information. As health professionals, we are skilled in communicating and translating complex medical and scientific information to patients in a clear and understandable manner. We also have experience breaking down complicated concepts and translating them into practical recommendations. And because of this, we have the ability to communicate how climate change is impacting the health of individuals who we treat, as well as the communities where we live, work, and practice. And last but not least, we have direct experiences witnessing the impacts of climate and environmental change on human health. Many of us have had firsthand experiences seeing how climate and environmental change impacts our patients, impacts our families, and this direct experience gives us compelling stories and examples that we can use to effectively communicate the urgency and personal relevance of climate change. And just so you know, we're not alone in these experiences. In this recent large multinational survey of health professionals, most actually reported that they felt climate change was already impacting their communities across a broad range of categories where they live and work, and further felt that they had a responsibility to act. So I'd like to share with you one of my stories of what I've been seeing where I live in Colorado, which is located kind of in the center of the United States. So over the past decade since I've lived here, we've seen a rapid increase in large wildfires, which is being driven by droughts as well as high temperatures. In fact, climate change has actually doubled the area burned by wildfires across the American West over the past 30 years, relative to what would have been burned without global warming. And this is a huge problem, not just in Colorado, but actually throughout the United States. And data shows that at least 1 in 6 Americans are currently living in areas with significant wildfire risk. And so 2 years ago, in the middle of the winter, during a very hot and very windy, dry period, a wildfire broke out actually 10 miles from my house. It swept rapidly into a nearby community where it burned over 1,000 houses to the ground and forced tens of thousands of people to evacuate, including my friends. So that was really just one of these experiences where, you know, you sort of are aware that climate change is happening, but this is really, for me, when it really came home. During this fire, there was also a huge threat to a nearby health facility in this neighborhood, and the health facility was forced to evacuate hundreds of patients, including a neonatal intensive care unit. It was really scary during the time because flames from the fire came up to the hospital walls and actually came within feet of hitting these liquid oxygen tanks, which were being stored outside. Thankfully, they did not catch fire, but the hospital did experience quite a lot of damage. So in the days to weeks that followed this wildfire in the region, we saw increases in cardiac and respiratory complaints. And this was especially true for vulnerable patients such as elderly and children. We saw and treated traumatic injuries. We also saw lots of mental health issues as a result of people being forced to evacuate and basically losing everything they had. In the aftermath of this wildfire, we learned that the city where this occurred and the hospital were not actually prepared to deal with wildfire threats, and that the emergency plans and emergency evacuation instructions had not been updated since the 1970s. So as an emergency physician, I'm sitting here asking myself, how can public health officials not realize what the risks are? And what can we do to change that? And what will it take for us to be able to communicate to hospitals and health systems that we need to take climate risk seriously? Furthermore, how can we warn and potentially protect vulnerable patients so they can make plans for themselves and for their family? And so these are the questions that really drive me to do the work that I do. So we'd love to invite everyone here, all our participants, to take a moment to write what their experiences are with climate and health impacts, where you live, where you work, what you've seen, and share it with us in the chat. So thank you so much. And with that, I will turn it over to my colleagues who are going to share their stories about what they've seen and how it drives them to do this work.
Okay. So, yeah, let's invite our colleagues. We have colleagues from the partner organizations who will be sharing a bit of their stories, very short stories. And then after them, we can accommodate, maybe one or two or three of the participants to tell also their personal stories of climate change and health, and basically to answer the question, why are you in this Zoom or in this virtual classroom? So maybe let's start with Raisa. Raisa, actually, you forgot to introduce yourself a while ago, so this is your chance.
Yes, hi everyone. I am so excited to see that there's so much interest in this topic. I am a pediatrician from the United States, and I was originally born in Bangladesh and grew up there, and later moved to the state of Florida in the US. And as you may know, both of these areas are regions that are plagued by increasingly intense hurricanes or typhoons, as well as extreme heat and frequent flooding. So I grew up often missing school due to hurricanes, or while I was in Bangladesh, we would have to wade through knee-deep waters every monsoon season to secure our valuables from the home. This has made me always care about the environment, but during my medical training, as I started learning more and more about how climate impacts human health, I became very interested to work in the field of planetary health and spread awareness about the ongoing climate crisis, not just amongst other healthcare professionals, but also amongst the public and those who are in the government. So I primarily started learning more while I was in my pediatric residency training program, which is when I first started learning about the myriad of impacts that climate change can have, specifically on child health, especially as it relates to disasters and emergency preparedness. So around this time, for a global health project, I had researched and published a paper on the relationship between climate change, global migration, as well as child rights. This opportunity then allowed me to present on this topic later on at the National American Academy of Pediatrics conference last October, and I've since been able to continue providing lectures on climate and health to courses at various medical school and undergraduate institutions. Since then, over this past year, I have joined the Global Consortium on Climate and Health Education as a Climate and Health Fellow, and I have been working on programs such as this course to bring awareness to more and more people. My hope is that we can create an energetic health professional workforce that is equipped with climate and health knowledge and is also able to drive policy that will help to tackle this crisis. Thank you so much, everyone, for joining. I will now let Renzo introduce the next person.
well, let's call on Ramon San Pascual, who is the Executive Director of Healthcare Without Harm, Southeast Asia, our very reliable partner in this course, to share a bit of his story and his motivation, what brought him to this space of climate and health advocacy. Mon, the microphone is yours.
Hey, thank you, Renzo, and happy birthday to everyone in this room. We're celebrating as well Renzo's birthday today. Now, in my case, how did I get involved into climate and health? Well, in my student days, I already became a social activist. And then when I was assigned as an NGO worker, a young NGO worker in Bicol in 1992, I already initiated around Mount Isarog ecosystem in Naga, Pili, and the surrounding towns in Camarines Sur, the Mount Isarog NGO-PO Consortium. This is to address both the issue of livelihood, of health, environmental degradation, as well as flooding in the whole province of Camarines Sur. And one is that because of the destruction of the Mount Isarog ecosystem. So I would want to trace it back right there. And then in 2003, I was already deep into the reproductive health bill advocacy. We also formed the Philippine Population Health and Environment Network. It is the first initiative among many groups to see how people, health, and environment are linked. And what links them together is both public health and environmental health. And then I kind of become officially a public health advocate after I finished my MPH, University of Washington in 2007. And then I moved on in 2016. I joined the Healthcare Without Harm as both public health advocate and environmental health activist. And in 2017, the Healthcare Without Harm as a global organization launched this global program on climate and health. And then that kicked it off. Soon we released the study on the climate footprint of healthcare sector. Then we released next the blueprint on how to decarbonize healthcare sector. And now we are joining all the globally, regionally, and in country, all groups that would try to rework understanding health in such a way that it impacts planetary health, it impacts climate change, and therefore, as a public health advocate, if only to be real into my mission and profession, to defend public health is to really honor the health of our planet, the health of our environment, and therefore to reverse climate change in the soonest time that we can. So, and this is why we're so happy joining this initiative, the Climate and Health Responder course. And I'm just grateful to Columbia, to St. Luke's, that today is just the beginning. And I'm based on the many comments, it will be an exciting set of discussions in the next few days in the whole month of June. So welcome to all. And again, Renzo, happy birthday. Thank you.
Thank you so much, Mon. Thank you also for the generous greetings and also for the greetings from all colleagues in the chat box. This is amazing and this is special. You know, perhaps my biggest birthday party so far. When we were planning for this course, we wanted it to start on a Tuesday because it's a Tuesday-Thursday course. And then it fell on this day, and my colleagues were asking, should we do it in another month or another day? And I said, no, we will do it on June 6th. So really grateful. And I hope that this celebration will just be the start of the growing of the movement. You know, Mon, I'm pretty sure you are equally thrilled and inspired by the energy that we're seeing in the chat box, right? It's like we just awoken or awakened a sleeping giant, no? Of a Southeast Asia health sector, no, wanting to make a difference for the health of people and the planet. And by the way, apart from the birthday greetings, the chat box is so rich with stories. So what we're planning to do is we will definitely, take notes. We will summarize the stories. And hopefully we'll be able to share them to you later on. The questions are also very insightful. We'll try to answer them either in writing or during the succeeding sessions that touch on the questions that you just asked. And then now, the last but not the least, we have my colleague at the St. Luke's Medical Center's Planetary and Global Health Program, Dr. Karen Ceballos. She's a research fellow leading our work on building climate resilient health systems. I'm very proud of Karen, and I'm very thrilled that she is here to share her story. Karen, this is your turn.
Okay, thank you. Hi, everyone. Hello to the 600 plus participants. That is an amazing achievement for the course. My name again is Karen Ceballos. I am a physician by training, like Dr. Renzo, but now I work as a research fellow in climate change and health systems at the St. Luke's Medical Center. So my story in particular is basically I'm what you would call a nature lover or an environment enthusiast. I have a profound sense of awe for Mother Nature. I love going outdoors, hiking if the weather permits, or generally just spending the afternoon outside if it's not too hot or if the rain is not too strong, as it often is in the Philippines. I come from Quezon City, so it's in Metro Manila for those of us who don't come from the Philippines. And it's a miracle that I have not experienced any flood, that I have not had to evacuate. So I'm quite lucky about that. But seeing how climate change is affecting the Philippines greatly, and it's devastated so many regions in the country from one typhoon after the other, I started experiencing what I didn't know what then was actually eco-anxiety or climate anxiety, which is the profound anxiety or worry for the earth, for the people inhabiting the earth, and also for the future. As a young doctor, it's hard to plan your future when you don't know what might happen. So as I was seeing patients, one patient after the other prescribing medications, I couldn't help but think that a lot of these medications will help one patient, but may not necessarily treat the problem, which we know, and we know that health is largely shaped by the environment. So then I wanted to look towards the bigger picture and see where I, as a doctor, as a young person, who has interest and love for the environment, and concern for the future generations, how we can help protect the people, also the planet. And that's how I found myself in the climate change and health space. And this is where really we can work towards not protecting just people, not just prescribing medications, but see how the system itself can change to also be climate adaptive, and also champion other advocates to join in the climate action. So I hope that by the end of this course, all 600 plus of us will all become climate advocates. Thank you. Happy birthday, Dr. Renzo.
Thank you, Karen, and thank you for telling your story. Karen and I and the rest of our team are really doing exciting things on this new nexus of climate and health. It's a new research area. So if, for example, you're a researcher or an aspiring researcher,
I think that's the Philippine internet. It's choppy right now.
We'll give
But
it
he'll-
just a minute maybe for Dr. Renzo to join back on.
Oh, there.
Hi. You
Is
just
it
cut
me?
out for a moment. Yes. Do you mind
Oh my
repeating,
God.
Dr. Renzo?
Oh, so what was the last word that you heard from me?
You're talking about our work, though.
Oh yeah, no, I'm just telling. Sorry. Oh my God, I didn't even realize that the internet. You blame it on climate change, right? Just kidding. Well, but that's another issue in the coming years and decades, right? With more typhoons, our interconnectivity will surely be affected, and that can lead to effects also on healthcare delivery, on medical and nursing education, etc. So there's so many issues, right? And what I was saying actually a while ago was that if you're a budding researcher or an aspiring researcher, you want to jumpstart your career in climate and health research, reach out to us, at the St. Luke's team, because that's what we're trying to do. This is a new research area, very understudied, but we know that climate change is going to affect many aspects of population, human health, and the planet's health. And we need more researchers to step up. So you've just heard 3 stories. One with a personal experience, direct experience of climate and health. Another of coming from decades, sorry, Mon, decades of activism, right? Social justice work. And finally, Mon, someone mentioned in the chat box that you are very qualified to be Secretary of Health of the Philippines. and you were called Dr. Mon in the comment. Mon is not a doctor, but he's a doctor for the planet. And of course, Karen, a young, energetic, emerging climate and health leader, doing pioneering work on climate and health systems research. You've just seen 3 examples, and I'm sure all 600 plus of us do have stories to tell. And I know that we only have 1 minute remaining. And I see that some people are writing their stories in the chat box, but I can give, a chance to maybe 1 or 2 to just say for 30 seconds, something, a story, their motivation. This is your chance. Like an open mic. Anyone who's brave enough to speak in front of 600 people. And you need to be very quick because we have very limited time. Going once? Going twice? Anyone who would like to share? Okay, Christine, our bravest in the room. And then we have Love also. So Christine and Love, very quickly, why are you in this course? Please unmute yourself. Oh, Christy's gone. How about Love? Oh, Luz Viminda, please unmute yourself. Hi, where are you
Hello,
coming from?
good evening.
Oops, sorry.
Hello, good evening.
Let's have Luz Viminda first.
Good evening, everyone.
Okay,
Am I
okay.
audible?
Okay.
Yeah, good
Please
evening,
raise your
everyone.
hand and we will unmute you. Okay, please raise your hand and we will unmute you so that we're a bit organized. Luz Viminda first.
Yeah, good evening, everyone. I am nursing profession, Jefet Tarlac Province. And when I heard about this course, I am very much interested because I've been a victim of climate change when I was younger. And I think being a researcher also, this is a good subject to dwell on because I've conducted researches on health and nutrition, and I am interested to dwell on this topic. And very excited to finish all the courses up to the last topic this June. And thank you so much. It's a very great opportunity. Like listening to you a while ago, Dr. Ginto, and that's very amazing presentation. And I would like to congratulate you and all the organizers, and salute to you, and God bless everyone.
Thank you, Luz Viminda. And let's keep in touch. Reach out to us. You'll have our emails later on. And Healthcare Without Harm and St. Luke's surely are happy to visit Tarlac in the near future. Thank you, Luz Viminda. Let's have Samantha. Wow, I'm seeing several hands. Okay, let's try to make this very quick. And we surely are extending our session. So I hope you'll stay. Samantha, please.
Hi, everyone. It's nice to meet you. I'm Samantha Ayala. I work under USAID Reach Health Project and also the Ateneo School of Medicine and Public Health Center for Research and Innovation. I'm not a doctor, just a public health professional. But the reason why I joined this course was because I recently got into more research projects related to climate change and health. So I'd really like to deepen my knowledge and my advocacy on it. Right now, we're working on a research project with Save the Children on the impact of climate change to women and girls. So that's why I think this course would be super duper helpful in really trying to, help myself become more grounded in the issues surrounding climate change and health. Nice to meet everyone.
Thank you, Sam. And please connect. Let's connect. Certainly, this is an issue that we are very, very interested in, how it's affecting especially women and girls. So kudos to you and to your team. Next, we have Christine, and then to be followed by Tikatat.
Hello, Dr. Renzo and everyone, all the panelists. I actually saw this, I think probably in one of the Facebook ads. I'm not sure exactly where I got it, but I'm not a doctor. I'm currently a full-time student in UP Diliman for MA Communication. And this semester, we've been tackling about CSR, communicating CSR, and we've been focusing on climate change as well. And I've been vocal and very verbal about it, that we need to really focus on making sure that we are greening not just our organization's business and every sector of the society. So I'm really excited to work with you. I don't know how to reach out to you because I'm interested in research for climate change, and I even was so excited when St. Luke's partnered with Columbia because they really are one of the top schools for climate change and climate science. So yeah.
Brilliant. Thank you, Christine. The way to keep in touch is to finish the course, and then you'll get our contact details afterwards. But and it's also amazing. We need not just doctors, but all health professionals and even non-health professionals. Although I always say every professional is a health professional. You can be an engineer, you can be an economist, you can be an environmentalist, but you're all contributing to the improvement of health of the people in the planet. So thank you, Christine, for joining us. Tikatat, and then followed by Mikol.
Hello, my name is Day. I am a medical doctor from Thailand. So I am currently working on the research about air pollution and its effect on the children's health. So I think is air pollution is maybe not directed caused by climate change, but it's due to the change of the human activity, human behavior, because we need more food to provide for the people in Thailand. So this is a main cause of the health problem in the children in Thailand. So I think maybe this course maybe will broaden my knowledge about the climate change and its effect on the children's health. And I think it may be I think it may be if we have some networking activity, right?
Yes. Yep. And again, I think there's a lot of suggestion about creating a community. So you'll hear more in the coming weeks. Thank you so much, Tikatat. And hopefully we'll have more colleagues from Thailand to join. Please spread the word. So, well, we're already 6 minutes beyond, and I can see several hands. And I want to both be inclusive, but at the same time, be respectful of people's time. If people do agree, we'll just finish the last 5 hands, no additional hands anymore. And if you can keep it to 30-second statements, that will be great. Let's have Mikol followed by Karel Jo.
Hello, am I audible?
Yes, very
All
clearly.
right, perfect. Actually, I'm studying at Cavite State University. I'm a student nurse. I'm currently at my 2nd year, and I found this responder course very interesting because I find this post on a Facebook post, and my brother's actually working at St. Luke, so it really caught my eye. And then I would really do some research about climate change as well and learn a few things about it. That's all, Dr. Ginto. Thank you.
Thank you so much, Mikol. Now let's hear Karel Jo, followed by Michelle.
Thank you. Thank you, Doc Renzo, and hello everyone. Good evening. I am Karel Calpita. I'm currently the SNT Fellow for Re-Emerging Emerging Diseases at the Philippine Council for Health Research and Development. So joining this course, I think, is very timely. As I worked with climate change initiatives a few years back, and we are currently also supporting disaster risk reduction and climate change action in health in PCHRD. So we are also funding these researches. So I think joining this course would enhance our perspective regarding this initiative. So thank you.
Thank you, Karel. And hopefully more people will submit proposals to PCHRD. I know that this is a new area of research. Not many people are still submitting research proposals. So PCHRD should expect more proposals to be submitted in the coming months. Thank you. Let's have Michelle, followed by Mita, and then the last person is Love.
Hi, good evening, everyone. And first of all, happy birthday, Dr. Renzo. Thank you for the
Thank you.
very informative session for today. I've been a first responder and a volunteer during Haiyan. I'm also currently part of a group that uses zero embodied carbons in the construction industry. And I am also a private in the Philippine Mountain Rangers and Wildlife Enforcers. So what I'm really trying to do is push sustainability and really everything green in all aspects of my life. And I saw this post on Facebook as well as a colleague, Dr. Tony Ramos, suggested it to me. So I will be sure to stay for the entire session. Great to meet you all. Let's all connect on LinkedIn. Thank you.
Thank you, Michelle. Next, Mita.
Hi everyone, my name is Mita. I'm the communications head of Harbon Foundation, the oldest conservation organization in the Philippines. So for us to have sustainable conservation programs, now more than ever, we have to rework our messaging and be more relatable to make everyone realize how our conservation work and our key messages bring value to their lives. So no matter who they are, where they live, or where they are at life. So working with the health sector actually gives us more credibility to the statements that our health depends on the health of our ecosystems and the environment. So I hope we can all work together to communicate how focusing on planetary health directly helps protect everyone's health and well-being, not just of humans, but also all of the species that we share our world with. So thank you and happy birthday, Doc Quinto.
And thank you, Mita. We look forward to working with Harbon. And last but not the least, we have Love.
Hello, good evening, everyone. I'm not a health professional. I'm a volunteer and National Assemblyman of the Philippine Fraternal Order of Eagles. And we are already 1 million. And what we do usually is doing outreach and doing what you call this humanitarian activity. But I know the greatest role that we should do is to be a environmental warriors as we represent the Philippine Eagle. So we are ready for your for this kind of course, the responders course. Thank you for this.
Thank you so much, Love. And I am also very, very thrilled. I'm seeing Dr. Angelica Fortaleza from the Philippine Obstetrics and Gynecology Society. I'm also getting messages even from the Armed Forces of the Philippines. Our military doctors are also in the room. So we are a very diverse group here. And wow, what an opening salvo for a month-long course. And we really look forward to you sustaining your interest and your attendance, and you'll get a certificate after this, but then it will just be the start of a new journey for you in addressing climate change and protecting the health of our people and the planet. So I would like to call on Raisa. It's already 7 o'clock in the morning in the US, and Raisa will just give some final remarks and reminders.
Thank you so much for that. I will just go ahead and share my screen in a moment. Okay, is everyone able to see my screen okay?
Yep, but it's not full screen.
Yes, I am. Okay. All right. So I just wanted to give a couple of reminders at the end of session. Thank you everyone so much for joining the first session of this course. At the beginning of the course, I had introduced the pre-course survey. For those of you who haven't been able to complete it already, please take a moment to complete the pre-course survey, which is available on the course website if you have not already. All participants must complete both the pre-course survey now as well as the post-course survey, which is going to be administered later in order to receive the certificate. And please try to complete the surveys using the same name and email address. And if you use the email address that you would like to receive the certificate in, that would be much appreciated. I would also like to take a moment to remind you all that every Monday, you should be expecting a weekly email from the course. This will include relevant links as well as resources and references, and it will also include the recording of the previous sessions as well as a slide deck from the previous week's lectures. I know a lot of you in the chat were asking about that. And I did mention this in the beginning of the session, but every session will have external closed captioning, but only in English for additional accessibility. If needed, you can open this link on a separate window and see closed captioning of the lecture in English. This link will be shared at each session at the beginning of the session. As for the certificate that you will receive at the end of the course, this will be conferred upon completion of the course contingent on you completing certain criteria. So we do expect participants to attend at least 6 out of 8 sessions and complete both the pre-survey and the post-survey in order to receive the certificate. Thank you all so much for attending this session and for your continued interest and participation in the course. We know that there were some questions left unanswered in the chat, and we will be keeping track of those. So please do not feel as if we have not paid attention to your questions, concerns, and comments. We are very interested in all of the work that you are doing in the field. And for those of you who are interested in connecting with members and faculty of the course, we'll certainly make avenues for that in the future. Please refer to the course website for any relevant information. It's included here on this slide, but we will be sending it to you on via email as well. Thank you so much.
Thank you, Riza. And I think there are several colleagues who are still asking for the pre-course survey. We can post it hopefully soon before we close this Zoom. And yes, wow, what a great first session of the Southeast Asia Climate and Health Responder course. Thank you for your participation and see you on Thursday for the next session on extreme weather events and disasters. Stay safe and good night here in Southeast Asia. And thanks to all your birthday greetings.
Thank you, everyone. Great opening. Thank you, Renzo and colleagues. Bye.
All right, at this time, we'll be closing out the Zoom session. Thank you all for attending. We'll see you on Thursday.